Hello, Zoltan here from Adagio Hands, Releasing Stuck Bodies. I'm sometimes asked if I can resolve an issue in one session. This video talks about what happens after an injury, what happens to our tissues, and then the role of the manual therapist in resolving it and why it may take some time to completely heal an area and get you back to full functionality. So we'll start with looking at what happens to tissues and the timescales for that, and then looking at the role of the manual therapist. But let me just say that if you do have an injury that you have seen to promptly, and it's an injury with no antecedents, so no prior history, then chances are it may be completely resolved in one session. However, injuries are often just the tip of the iceberg. They're just the thing, the last straw, and the symptom of some underlying cause, some underlying weakness that manifested in injury at that time. Why was it your hamstring? Why was it your right leg? Why was it your left wrist that got injured? And why did it happen now? So those are considerations, all of which may lead to an underlying cause that needs a longer term program of sessions. But let's look at what happens to tissues. So if tissues are injured, of course, they need to heal, they need to go through the inflammatory process and then the rebuilding process. And broad timescales for this are as follows. For muscles, they may heal if it's a slight strain after 2 weeks, maybe 4 weeks. Obviously, if the muscle's been ruptured, completely torn apart, that's a different matter. Likewise, tendons, they don't have so much blood supply, so they take longer, maybe 6 weeks, maybe 12 weeks. With my musician clients, very often there'll be a tendon issue. If it's just an inflammation of the tendonitis, then it may take 6 weeks to heal. However, if there's tendinosis, fraying of the tendon and some damage to the tendon, it may take 12 months, and that's with a fairly robust 12 weeks, sorry, that's with a fairly robust program of intervention. Ligaments, another tissue of the body, those connect the bones together, they have hardly any blood supply at all, and they will take 3 months, 6 months or longer to fully heal. Again, if they're torn, then completely ruptured, then that's a different ballgame altogether. Bones, again, wide-ranging timescale depending on the nature of the issue. If it's a clean fracture that was put back together and it's a small bone, like a finger or toe, then maybe 6 weeks and it's as good as new. If it's one of the big bones, the tibia or the femur in the leg, 6 months to a year. And finally, cartilage, which is on the ends of the bones, the smooth area to keep the joints operating nice and smoothly, that has hardly any blood supply, and again may take 12 weeks, may take 6 months to heal after it's been damaged. So those are the healing timescales for tissues. Now, what has that got to do with what a manual therapist does? Well, manual therapist has two roles, really. The first is to facilitate the healing process. For instance, fantastic improvements to ligament healing by vigorous massage, by bringing blood supply to those tissues and accelerating the flow away of waste products and accelerating the flow towards of nutrients. The other role that a manual therapist has to play is a rehabilitation process. So ensuring that as those tissues are recovering, the muscles stay strong, the body maintains its structure, and the rest of the body doesn't go into decline. So those are the two roles. And let me give you an illustration of the kind of thing that will happen after an injury. Your nervous system may go into a state of tension and hold the tissues in the surrounding area tense. So through manual therapy, we can help to calm when there's no longer any danger. We can help to calm those tissues. And then after an injury, the area will not be moving much because we don't want it to move. We want scar tissue to form and we want the healing process to begin. But what we don't want is the surrounding area also to be immobile, because if tissues are immobile, then they'll start to get stuck together, they'll form adhesions, and they'll get less and less mobile with time. Wait a few weeks, that immobility starts to increase. Wait a few months, even more. Wait a few years, the whole area will be quite stuck. Let me give you an example. Imagine this is some of your tissues. Look at this. It's a resistance band that's been scrunched up for a while. Do you see that it takes some while to undo that stuckness, those adhesions? And just when you think you've undone some of them, oh look, on the other side of the muscle, there's even more that you didn't even think about. And that's just one muscle. And look, it's stuck there as well along its whole length. So it takes a while to peel away all those layers. Okay, now imagine someone who wasn't seen to promptly. Their tissues will look more like this. Look at that. I can't even pull it apart. This would hurt if I tried to do this on your tissues. So we'd need to work a lot more slowly, a lot more adagio, helping to slowly peel apart without tearing, and asking you also to do some mobilization and stretching in between sessions. And in fact, not only are these adhesions needing resolution, but because this muscle isn't really doing much work here because it's all stuck, other muscles will be overcompensating, and the whole body, your posture, your gait will adapt. There'll be other imbalances that will then need to undo in order to fully liberate the body and this injured area. And then we'll need to do some stretching and strength training to ensure that the original muscles that need to pull their weight actually are strong enough to do so. So I hope that gives you an idea of why this work may take some time. And the more you're committed to the work, the quicker you'll develop and the quicker you'll get back to full functionality. If I can give you a word of advice, it's often worth just setting yourself a time scale for when you want something completely resolved, a realistic time scale. So the normal, sensible thing to do, unless it's a very, very acute injury, is to try some self-care for yourself and see if that's going to resolve things. And it could be that after a week of self-care, you've made significant progress. Fantastic. Keep going. And that means things like mobilization, stretching, some self-massage, and so on. But if after a week of self-care you've made no significant progress at all, and definitely if there has been significant progress after a month, then you really want to be thinking about seeing a manual therapist before things really get entrenched in this kind of way. So if you set yourself that time scale, that means that you won't keep drifting, putting it off, and things getting worse and worse. You set yourself a time scale, you'll do your best with your self-care, see some other videos for what you can do with that. And if that doesn't quite do the trick, then you know it's time to go and see a manual therapist. So self-care, doing your exercises, and if after a month you still haven't made absolutely significant progress, then do see a therapist. I hope you found that helpful. Thank you for listening.